So our patient has been numbing for about 30-ish minutes and she's nice and numb. So we're gonna, again, remove the numbing with an alcohol-based wipe. We want all of that lidocaine off her skin because we don't wanna push that in. That can impede on the integrity of the stem facial and the overall treatment. We just don't want that lido inside her skin. So we're gonna get her all cleaned up. With some microneedling treatments, we will find that they'll wipe off numbing at different times, but because this treatment is so quick, we're just gonna do the whole face right now. I did numb the top of her nose just because she's got some larger pores. Normally I wouldn't do that, but I did. You okay? All right. Okay. All right, we have the S2. One of the things that I didn't discuss before that is different about the S2 than any other pen. We talked about the 3 tips. We're going to use a 12 needle tip today. But the way that it actually goes in, it screws in completely. There are some pens out there where the tip will actually fall off mid-treatment. We definitely don't want that happening. So when you screw it in nice and tight, that makes sure it's super secure. The other thing is, let me remove the sheath here. This has a port in it. So we know that when we microneedle, these needles are pumping in and out. It creates a suction or a vacuum. And when that happens on most of your traditional non-scallop tips, again, this is scallop just like the NG tip. And again, the scallop allows the serum to pass through so you're not dragging or tearing the skin. But what this port does, which is very unique to the S2, is that it allows air to go in and out so it doesn't suck back on the tissue. What can happen, especially when you don't have a scallop tissue and no port, is that the tissue domes inside the tip. Well, all of these needles and in all of the pens, the needles are the same length all the way around. So if your skin is deeper in one port and more shallow in another, it's going to cause a propensity for tearing or scraping, and that we know can lead to PIH. Okay, so our tip is in. I'm going to take out my stem facial matrix. Again, there's 5 vials that come in these. It's just 1 per patient per treatment. The one thing that I will say, if you do use it with the roller, we have some accounts that will take the roller part of it off altogether because they just choose to put more on. I like using the roller because, 1, it controls the amount that you're using so you don't overuse serum. But what I will say is I limit the areas to smaller areas because this is water-based. It does get sucked up into the skin really quickly. So we want to make sure that it's nice and glossy as we're going so you have that glide. Okay, so for her forehead, we're going to start at 0.3 and see how we are, where we're at. The clinical endpoint for microneedling is pinpoint bleeding, so we are going to go until we see pinpoint bleeding. Thin skin, so we're going to be on first speed, speed 1. We are going to go in small circular, I'm talking dime size circular motion, or you can do little lines back and forth. I'm making like an S here. I'm not seeing pinpoint bleeding, so I'm going to increase to 0.5. Okay, still not seeing that. So I'm going to go to increase to 0.7. And apparently she's got nice thick skin. Okay, and I'm starting to see lots of erythema in this area, so we're going to move on. Just get good coverage in all of that area. And I may come back to this area just because it's our first. I'm gonna go back over, wipe this, and move over. Apply my stem facial. So I did section the forehead off into halves. Like I said, again, if you're using the roller, you want to make sure you have nice, lots of glide. I am still not seeing pinpoint bleeding, so we're going to increase our depth and we're going to go back over this area. All right, now we're going to move on. If they do have 11s or lines in their glabellar complex, you're going to want to go over those. If they do have static lines, you're going to want to go over those a little bit more aggressively. And we're finally getting that pinpoint bleeding, which makes me really happy. She does have a couple of static lines, so we're just going to hit those up. And now we're going to move on to the rest of the face. With microneedling, you're always going to want to treat from the top down. Even if you're treating body, you're not going to treat body first and then the face. You're always going to treat from the top of the face down. So now we're going to go around the temples and around the eyes. The eyes, again, the tissue is very, very thin. So we're going to use a very superficial mode. She is having, she has thicker skin than most patients. So we're going to have it at a thicker or a deeper level. So we're going to go back to 0.5. Normally I would go to 0.25 for the eyes, not for Miss Mariella. You start to get these crow's feet and these fine lines and wrinkles, so you want to make sure that you're getting in those areas. You want to give them the best treatment possible. So it looks good there. Pull that tissue out. A lot of times too, when you have patients that have darker under eyes, this is going to help cause blood flow to that area. It's going to help with dermal thickening. It's going to help really brighten those eyes up. Okay, so we're going to move on to lower face. Again, I'm going to half this. I'm going to go to a much deeper depth of penetration. I'll start at 1.5 and see where we're at. But half of this lower quadrant here, going to 1.5. And then I'm going to go to the second speed. I love this pen just because it's so smooth. I think a lot of the pens will grip. This just doesn't do it. It's such an awesome pen. So she's nice and red throughout. If you have a patient with a lot of laxity near the ear, you're going to want to pull that out like this and then treat that area. We're going to apply more stem facial. I'll do around her mouth separately. We're going to do that at a less of a depth because one, it tends to be a sensitive area, and two, we don't necessarily need that depth. If she had, pretty deep perioral lines, otherwise known as smile lines or smoker lines, if she had deep marionettes, then maybe we would go deeper, but she doesn't have that. Okay, looking good. All right, we're going to go to the other side of the face. Second speed. You see me doing like a couple extra passes, and I just want to give good delivery of this. We are only using the 12 needle tip. If I was using the 36 needle tip, we would not be doing as many passes. Historically, with microneedling, we see, practices using a number of different topicals or transdermal delivery, agents. Hyaluronic acid is one that we see very often. When you're doing that treatment, you're typically only going to charge somewhere between maybe $350 and $500. Once you get up into growth factors, you're going to want to charge somewhere between $550 and $850. And then when you are using things like PRP, it's always important, or PRF, it's important to take into consideration what your consumable cost is and what that needs to look like in regards to what you're charging your patient. So I'm going to reduce this to 1.0. I'm going to go back to the first speed. Just around the mouth. If you do ever feel like, just based on the tissue and the area that you're treating, that it does pull a tad, you can always just kind of go into that stamping technique. And then I did mention that I wanted to treat her nose. I did numb the top of her nose. So I'm just going to apply a little of this. I'm going to go very, very superficial here because this is not a comfortable place to treat. But I just wanted to address some pores that I saw. So I'm going to reduce this all the way down to 0.25, which is what we were using in the scalp previously. So they barely feel anything, but it does make all the difference. Okay, so she is looking great. Now that we're done, I'm just going to go back over the skin with the stem facial. To the patient, you want to let them know, Mariella, that you're going to leave with this matrix bottle. So anytime you feel dry, don't put anything on your skin if you don't have to for the next 24 hours outside of tonight, a gentle cleanser, and then this again. I want you to use this until it's done. But anytime throughout the day today and the next 24 hours where you feel dry or tight or maybe itchy in that healing process, just apply the matrix. All right, my dear, you are done. With any of your microneedling treatments, it's important to tell your patient that they may experience 1 to maybe 3 days of downtime. I've even had intense treatments that you would get with a 36 needle tip where you actually peel a little bit after the fact. That's okay. It's very important that they stay out of the sun. Any injury to the skin and then going out into the sun before that's healed can cause post-inflammatory hyperpigmentation, especially with your dark skin patients. So microneedling is a staple in every practice. Make sure that the pen that you have is customizable, that you can do multiple things with it, that it's FDA cleared so you're protected, and then just have fun with it. It's such a fun, easy treatment, renders such great results. Definitely consider the CytoPen S2 or the CytoPen NG from Amash.